before you dispersed for the lunch, we had a residual stenosis in the subclavian vein, and I totally agreed with Dr. McNamara, who was not very much in favor of a stent, and he wanted a prolonged balloon dilatation. Next, please. So we went ahead and gave a prolonged balloon dilatation with an 8 millimeter balloon, and followed by a prolonged dilatation with a 10 millimeter balloon. This is an 8 millimeter balloon with a prolonged dilatation of about 5 minutes. Next. Next. And this is a 10 millimeter balloon dilatation. Next. And this is the result which we got in the end. And now we have passed the catheter beyond the stenosis, and so it's like an antegrade flow in the vein. And we see the flow, the lumen is quite acceptable and the flow is good. We also checked it from the cubital vein and got an angiogram, and we accepted this result, and we have shifted the patient out. Next, please. So that's the DSA. The patient moved a little, but because the patient was a little irritable, this is the final result which we got. And I would sort of seek the advice of the expert panel. What do they think about the result? Should we have gone ahead and stented, or this is a good result for the surgeons to make AV fistula on the right side? Next one.
I think, Dr. Khanna, after making that AV fistula, this vein will further dilate.
Yeah, that was my thinking also. Once we make an AV fistula, this vein is going to dilate further and further. And once we have a good flow here, this is a 6 French catheter, we at least have a 7 millimeter or 8 millimeter lumen right now. And I don't expect a lot of recoil after this, and I do believe that the veins would dilate after this. Next.
I seek the opinion of other persons who may be interested to give any comment in this situation.
Can I have a mic, please? Dr. K.R. Suresh from Bangalore will be asking some questions. Mic, please. Just a second, sir. Just a second, sir. We'll get the mic for you.
Dr. Khanna, Suresh here. Can you hear me?
Yeah, welcome.
Okay.
Good morning, Dr. Suresh. Welcome to New Delhi.
Thank you. Thank you very much. Now, there have been huge number of reports which say that whatever you do in these patients, straightly post...
It's not a long-term result. It's more of a ongoing... we have to accept repeated procedures to make it functional for a year or two.
Yeah, we tell our technicians and the nephrologists, if you find a flow less than 400 collars, but never do, it comes to 150, only then the collars, by that the fistulas are closed. Unfortunately, that happens most of the time, at least in our place.
Right. I would agree with you, but so what would your approach be in this case? How do we go ahead and have a dialysis access for this patient?
I don't know. We try different means, auxiliary